First of all, I would like to thank AIOS, APAO, and Dr. Indamohan Rastogi for giving me the opportunity to present on this prestigious platform. So the topic given to me is initiatives under NPCB for cataract blindness interventions in Haryana. So first of all, a brief overview of the state of Haryana, which is composed of 22 districts, and the population is about 30.2 million. The prevalence of blindness in the population is the same as the national, 0.36%, and the prevalence of blindness in more than 50 years of age is 2.21%, whereas the national one is 1.99%. Under the leadership of Director General Health Services Haryana, Dr. Kuldeep Singh, and the State Program Nodal Officer, Dr. Jagdeep Singh Basur, the NPCB works for the betterment of the people. Now, what is the present scene? The burden of the disease. In Haryana, approximately 1.35 to 1.5% of individuals aged 50 plus are blind due to cataracts. This translates to roughly 13 to 15 blind individuals per 1,000 in this age group. This is according to the survey conducted by NPCB from 2015 to 2018. Nationally, the longitudinal aging study in India indicated a cataract prevalence of 12.25% among adults aged 45 plus, with Haryana showing a lower state-specific rate of 9% for females and 8.7% for males. Now, the burden of the disease vis-a-vis Haryana and our country, India. Cataract blindness in more than 50 years of age in India is 66.2%, whereas in the state of Haryana, it is 60.5%. Severe visual impairment due to cataract in more than 50 years of age is 80.7% in India and 53.7% in Haryana. Cataract surgical coverage for blind in India is 93.2%. In Haryana, it is 96%. Now, microplanning for declaring districts cataract blindness backlog-free Haryana. We say a goal without a plan is just a wish. So the team works at planning and executing. Various campaigns that have been proposed in our country are Cataract Blindness Backlog Free, Rashtra Netra Jyoti Abhiyan, Pradhan Mantri Motiabind Mukt Bharat Abhiyan. Now the assessment that we have already done, we have assessed the disease burden. Then we have to assess the available screening capacities which are available, and then of course the surgical capacities. Now the human resource management, it works in a three-tier system. First of all, a primary screening is done by the ASHA workers, the Anganwadi workers, the multipurpose health workers, and volunteers. The confirmation is always done by the optometrist and the ophthalmologist, and then come a team of surgeons, OT assistants, and nurses. Now, how do we evaluate the program? Minimum benchmark standards for declaring a district cataract blindness backlog free, they have been laid down. The cataract surgical coverage for blind persons, that means whose visual acuity is less than 3/60, should be above 98% to declare the district cataract backlog free. The post-operative complications leading to blindness in the operated eyes should be less than 2%. The visual outcomes of cataract surgery should not be less than BCVA of 6/60 in more than 5% of operated cases. This is as per the WHO criteria. Now, the cataract surgeries in our state for the past 6 years. Now, you can see the data, quite a number of surgeries have been done. Now, in the year 24-25, we have the data up to the month of February. 30,248 cataract surgeries were done in government sector. The NGOs helped by conducting surgeries about 13,226. Of course, the private sector, the number is bigger. 1,43,989 surgeries were done, which comes to a total of 1,87,463 surgeries. Now, the NGOs play a very important role, and under NPCB and our government, state government, they clear the funds of these NGOs as soon as possible, and they have been encouraged. So, in the year 24-25, 13,226 surgeries were done in the state of Haryana. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, we know this is a PET scheme that had been launched by our Prime Minister. It was launched in the year 2018. Cataract is one of the approved packages for private hospitals in our state of Haryana. Eye hospitals empaneled under Ayushman in Haryana are 245. There is a Charayu scheme that works in Haryana. In this, all Antodya families of Haryana are included, and it covers a population of about 1.59 crores. Cataract and other eye surgeries conducted under Ayushman Bharat Abhiyan. So we can see in the year 24-25 only 1,03,283 surgeries were conducted under the Ayushman scheme, and other eye surgeries under Ayushman scheme were 22,726, which is quite a number. Now, what are the initiatives in government institutions? NPCB has been proactive in strengthening the medical colleges. We have provided equipment worth rupees 1 crore to Medical College Rohtak, Sonipat and New. Facilities of phacoemulsification with foldable IOLs have been provided in every district hospital of Haryana. All the conditions to declare a district CBBF, that means cataract, blindness, backlog free, have been fulfilled for district Gurugram and Ambala. Equipment worth rupees 10 crores have been installed in the districts recently. Now, Center of Excellence at Panchkula, this is the place where I am also working. So we have with the cooperation of Hero Motor Corps under CSR, equipment was donated which was worth rupees 2.6 crores, and the latest Centurion phaco machine, Zeiss Angioplex OCT, harm-free perimeter and green lasers have been installed at our center. Now, DNB courses. The department is very proactive in enriching the department and providing training to the budding doctors. DNB ophthalmology courses are available in District Hospital Panchkula, District Hospital Ambala City, SDH Ambala Kent, District Hospital Faridabad, District Hospital Palwal and SDH Bahadurgarh. Now, what is the way forward? Now, as everybody was emphasizing on telemedicine, we also want to use digital technology, AI tools in screening blindness and diagnosing cataract through teleophthalmology. Also, we want to give cash incentives to ASHA workers and volunteers for bringing cataract blind patients for surgeries to government hospitals and NGO hospitals, because we all know that the periphery still remains missed out. We are still getting hypermature cataracts, so we are very proactive in getting those cases well on time. Last, thank you for listening to me.
Thank you, Dr. Hiteshi. So, I request Dr. Ruchi to please come over on the dais. So, the government of Haryana, of course, doing a lot, and you know, the nice initiative under all these government-sponsored schemes. So, thank you for enlightening that. Dr. Ruchi Dabas will speak for Dr. Manisha Rathi. Please.
One comment, please.
Yeah.
Actually, in government setting, the cadre of community health officer is there, and so much emphasis is going on collaboration and cross linkages. So we have well-defined criteria how these cross linkages are utilized by NGOs even. So kind of as Dr. Manpreet Madam emphasized on collaboration, we can take help of government machinery for our advantage, because NGOs are also working with the same purpose. So we have a detailed guideline on Npcb&vi website, where the role of CHO and the people working under them very well defined. Second thing is cross linkages. Cross linkages means as far as government health sector is concerned, we can it is like formulated for that, but we can also take advantage of it, because the PHC people, the patients coming to the PHC are referred to the higher centers, not to overload them. At the same time, the people or patients has not to have that resource spent so much on their small ailments or eye related problems. So the now more emphasis is on cross linkages as well as collaboration with the government, as Madam rightly said, PPP model.
Yeah.
Thank you.
Thank you.
Your
Thank you,
your
Dr.
peop
And also the NPCB is clearing in Haryana Haryana, there's no problem of clearing incentives or funds. Means they are cleared on time. Only during COVID we had a dip for the NGO cooperation. Now again it's like full on working.
But Haryana is doing very good.
Yeah.
In a sense, DNB program is also
Yeah,
there in
Yeah,
at
in
district
every
hospitals. That is
yeah.
not even in Gujarat.
Yeah.
So it is
And we are
wonderful to
training
note.
doctors, they are passing at very good
Dr.
rates.
Hiteshi, I slightly differ. Means, or rather, I would like to know from you that what efforts are being made by the government in streamlining the process of payment either to the NGOs or to the private hospitals for these cataract surgeries.
Sir, in private hospital like Ayushman Bharat, in NPCB and the state of Haryana, they have covered Ayushman Bharat for private hospitals also. The private hospitals are giving free cataract surgery.
Agreed. My focus is on pending payments.
So they have been cleared on time.
No, I may tell you,
In
the
Punjab,
hospital
the
where I
scenario is
am,
different.
it's worth 1.3 crore, which is
Yeah.
pending for
In
the
Punjab,
last
the scenario
10
is
months.
different.
That-
Yes.
that's
That
right.
is
From
the last
Haryana.
10 months.
Okay,
And same is true with NGOs for whom we pay only for cataract in the government sector.
sir, for
Yeah.
most of, I'll take up your case with the
Uh,
NPCB, but sir, for most of the cases they are being cleared on
No,
time.
Because I have conveyed this to your HIAPS also, because Dr. Kuldeep, he has been working with me as DMS when I was a medical superintendent and director, and so I told those people also.
Thank
But everybody is helpless, I may
payment,
tell you.
definitely payment is the issue.
Means
and
I may
that is
tell
the-
you the health functionaries are helpless in making the payment.
Yeah.
Even if they intend to,
Yes.
still it is in the hands of the bureaucracy and the finance department.
Yes.
At the same
That
time,
is-
health is a state subject, so state is independent to do. That's why this discrepancy. Because
Payment issue
Maharashtra,
is
Andhra Pradesh
definitely
doing
out
good.
of context of
Yeah.
this session. So thank you.